I would begin also by acknowledging the traditional owners of the land on which we meet and pay my respects to their elders past and present, and particularly to the people of the Kulin Nation and the Wurundjeri and Bunurong clans, and how appropriate it is that we should acknowledge that, given that we're talking about what kind of caring society we want to build here in the Australia of the 21st century, knowing that we do so on the land of a caring society that runs back hundreds of thousands of years. Leaving aside a bit of the notion that we meet here today in a lovely surrounds to talk about entrenched disadvantage, I do in fact acknowledge the great work that CEDA's done in bringing this report and putting disadvantage, entrenched disadvantage, in both a social and economic frame of reference. If I can just perhaps briefly talk about my own path to get to this podium, not just from that table, but a long time ago, it seems like a very long time ago, I started my professional life as a community development worker on a public housing estate not so far from here. It was an experience that gave me a real sense of what it means to deal and live with long-term disadvantage, what it means in people's lives beyond just the statistics, what entrenched disadvantage means in a real human context. I went back to that estate as Minister last December, and I saw some of the same people and many of the same families. Like me, they were a lot older, but my life circumstances and opportunities through education, through opportunity and through family support had taken me in one path, but their life and their paths hadn't changed much at all. They were still battling with many of the same issues that this report today details. Like me, they were a lot older, but unlike me, they were sicker and they were increasingly disabled, and they came from diverse cultural backgrounds, much more so than the white Anglo-Celtic stock that I come from. It's an example of what it means to be stuck in the cycle of disadvantage, of entrenched disadvantage, and the causes that that means for individuals' lives and, more importantly, for the communities that they're a part of. I've also seen the enormous capacity and the goodwill that those people bring, that those communities bring, to want to contribute to their community, and that we shouldn't confuse disadvantage with a lack of capacity or desire to contribute to community. And that's what this CEDA report clearly outlines. It outlines the scale of the challenges we face in tackling entrenched disadvantage in Australia. It outlines the scale of the opportunities that the contribution to community and to their own lives that can be made by the millions of Australians that we're talking about. It is to CEDA's credit that you are looking at this issue, because there is sometimes the assumption that market forces alone will somehow magically resolve the challenges facing the most vulnerable people in our community. That somehow or another the trickle-down effect of growth, no matter where it is, will assist those at the bottom of our social pile. The evidence globally, not just in this report, of the last 30 years of changes in our economy and our society tell us otherwise, and that wealth doesn't easily trickle down. And in this respect, your report is pretty sobering reading. 2.5 million Australians with an income below that needed to have a socially acceptable standard of living. 1 million people facing deep social exclusion when you measure non-financial aspects of life choices and opportunities based around employment, education, social connection and health. And in the period from 2001 to 2012, that is in the professional life experience of all of us in this room, about a quarter of the people who managed to exit poverty had returned to being poor within 2 years. And about 12 to 15% of households that were poor by these measures in 2001 were still poor in 2012. Disadvantage of that scale and that entrenched nature poses some fundamental challenges for governments and for the traditional models of delivering community services. Not surprisingly, there is no magic solution, and your report does not identify one. But just consider some of the following. It means that there is an increasing demand on government services. For example, family violence now represents 42% of all crimes against the person reported in Victoria. And in 2013, there were more than 65,000 family violence incidences attended by Victoria Police. If we work on the basis that New Zealand is a comparable society in terms of numbers and make-up to Victoria, the reported family violence incidents there last year was 100,000 people. So we've still got, sadly, a long way to go in terms of under-reporting of what the impact of family violence is, let alone its consequences in our community. There are increasing expectations about the scale and the quality that government services will bring. People expect more tailored approaches to the services that government and community bring, one that meets their specific needs. People using services have increasingly complicated needs and multiple lenses of disadvantage and vulnerability that they bring to those needs. For example, people who have a mental illness and who are or have been a risk to other people, they need a joined-up response, not just from their health and criminal justice systems, but from their own community and from the own support that they bring to their life. But to be unwell and to begin with the experience of homelessness on top of that contributes to both mental illness and health illnesses. Then there's the challenge of how past investment has increasingly gone into crisis-driven end-of-systems services, and as a consequence, not enough funding going into early intervention and prevention programs, not just in the mental health report that Steve spoke about earlier. There's the need to help people in more sophisticated ways, including helping people to participate and engage directly with their own local community, because factors like social isolation and poor health can be just as damaging to someone as lack of income. And there is the fundamental problem of a lack of systematic long-term investment in the community local support services. And that's particularly an issue for the Commonwealth, who raise the vast bulk of taxation revenue in Australia, whilst the states continue to deliver the vast bulk of services. The combination of these challenges, amongst others, and the scale of these challenges suggests, unsurprisingly, that we need to continually rethink the way government services are planned and delivered. There's nothing new to see here. This is a problem that we all know about. But perhaps one way to do that and to think about things differently is how government itself arranges its activities in this field of social and community policy. I always like to remind people in the short time that I've been Minister that I'm not the Minister for Housing, as it said in the paper, nor am I the Minister for Ageing, nor am I the Minister for Disability. I'm the Minister for all of these things in the one portfolio deliberately. And whilst I also bring as a separate portfolio the Minister for Mental Health, that all gets rolled in together because it's these different lenses of disadvantage that I bring to this portfolio and to the new operation of the combined Department of Health and Human Services in Victoria. Because, as Steve said, you can't deal with disadvantage and entrenched disadvantage unless you deal with all the frames that consequently position people in entrenched disadvantage. This report and this opportunity that I'd like to think we have with a new government in Victoria might well give us a once-in-a-generation opportunity to seriously address the root causes of entrenched disadvantage rather than just continually addressing the symptoms. But rather than worry about what's on my actual business card, we need to look at the fundamental changes in the way that we deliver as a government and partner with community and the private sector those services. There's many examples, but I just wanted to focus on one for the sake of the debate, and that is changes to the National Disability Insurance Scheme currently being rolled out. So what I want to do briefly is just offer a snapshot of where we are in the implementation of the NDIS and use that as an example to show us and to learn some lessons about how we can deliver services across the range of the lenses of vulnerability that people bring to the NDIS to try to reduce entrenched disadvantage in our community. Many of you will be familiar with the NDIS and the philosophical shift it brings. Some of you helped write the report, indeed, that helped bring us here today. But just to briefly recap on some of its features. Like all big social changes, it's a shift in power and resources. Under the old system, funding for disability services was provided in block grants to service providers who then delivered those services to clients in a queue. It was a ration system. When the rations ran out, the queues grew. Under the NDIS model, individuals or participants get the funding and they then decide on who they will purchase and how they will purchase services from. Importantly, these services can and are being provided by the community or increasingly the private sectors, not necessarily by government. So there is deliberately a much stronger element of choice and the notion of a marketplace in the way that these services are offered. And because it's based on an insurance or actuarial model, the NDIS looks at what people's lifetime needs are going to be, not just a financial year to financial year assessment. It's funded partly by an increase in the national Medicare levy, but it's also funded by contributions from states and the Commonwealth. But it's based on a fundamental principle that by providing better services to people with disabilities and families, when and where they need it, on choices and basis determined with informed support by them, we will actually end up saving money in the long term. For example, the workforce participation rate for working age people with a disability in this country is just 52%. The comparative figure for people without a disability runs at 83%. If only we could get the employment ratio for people with disabilities to just the average OECD benchmark, then employment of people with mild to profound disabilities will increase by 100,000 people by 2050. In fact, when the Productivity Commission did the modelling, they suggested that the wide range of reforms associated with the NDIS would likely raise employment by considerably more than that 100,000 figure. They said that under a reasonable scenario, there could be additional employment growth of up to 220,000 people by 2050. This would also include many people who are currently almost the full-time carers of many people without disabilities. As that person receives National Disability Insurance Authority support, their carer will also have more opportunities for employment. The notion of who's a lifter and who's a leaner in these circumstances changes fundamentally once the system is operating. So as the Productivity Commission pointed out, the scheme makes a lot of economic as well as social justice sense. From my point of view, it makes a lot of social sense as well from how the Victorian Government operates. I want to acknowledge the presence of one of the Productivity Commissioners here today, Alison McClellan, and she is someone with a very long standing interest of how we reduce disadvantage in our community through such models. But just as importantly as the economic benefits, the scheme is ending what Bill Shorten, one of the architects politically of the scheme, called the social apartheid that exists in Australia for people, carers and families living with a disability. The scheme will mean more people living with a disability and those caring for them are going to get the support they deserve. It should mean an end to the waiting periods that people experienced under the old system. And that will mean that there will be opportunities for those individuals and families to contribute to their community. It's worth reflecting on the scale of change that is heading our way should this happen. There are about 1.4 million Australians who have a severe or profound disability. There are twice as many, 2.8 million people, who are providing informal care to an older person or someone with a disability or a long-term health condition, all of which are forecasted to come within the purview of a fully implemented NDIS by 2019. So this is an historic change dealing with many of the principles contained in today's CEDA report. So it's crucial that we get it right. Before I discuss some of the lessons that I think the NDIS can teach us about other areas of reform in entrenched disadvantage, I want to briefly note where we are in the implementation of that NDIS. And to be blunt, we're at a critical juncture if we are going to deliver on the benefits of that scheme. It's a great opportunity if we get it right, but if getting it right, we need to also get ready for the vast array of consequential changes it will let loose across the community services system. As we know, the NDIS has been running at a number of trial sites around Australia to see some of these changes in practice. One of these is down the road in the Barwon area based on Geelong. The overall results have been positive and Victoria continues to be a big supporter of the scheme. That said, there are significant issues and we have some concerns that need urgent attention. As I noted earlier, the NDIS does introduce a market approach to the provision of disability and community support services. The truth is that markets can and do sometimes fail. Now, at a CEDA function, I'm sure I don't have to spruik the benefits of markets, but there are legitimate concerns about how markets operate in human capital or community services systems. It's crucial that we have well-designed markets that are underpinned by suitable and appropriate and rigorous safeguards and standards. Providing disability services cannot become a free-for-all. It cannot be allowed to be opened up to fly-by-night, low-quality providers who push out the genuine, high-quality service providers. There are also legitimate concerns about workforce transition issues. Overall, the NDIS is expected to be a substantial generator of new employment opportunities. But there are big questions still to be answered about how we support existing service providers in the transition to the new scheme, whilst making sure that new entrants provide quality service. We need to think carefully about how the NDIA, as the agency charged with delivering this service by all the state and the Commonwealth governments, sets its price in constructing a person's individual support package as the basis for that market system. If the price is too low, then the disability service provider won't be able to provide the choice and the quality of support that the participant, the person, requires and expects. If the price is too high, then the value for public money won't be achieved and the NDIS will not be financially sustainable. If it's to step back and just let the market rip, then the cost of market failure in delivering of services to people and communities will be unacceptable. Some of the proposals floated by the Commonwealth at the moment to set that price are far too low, to the extent that they wouldn't even meet the current tests for overseas home care workers entering Australia on 457 visas. Victoria's view is that if we want sustainable, high-quality service providers, then we have to have a sensible approach to setting that price and fund it accordingly. We can't and we won't be involved in a race to the bottom. We also have concerns about some of the more technical but crucial financial arrangements for meeting what's called the user cost of capital in situations where a person requires an integrated housing and support model to how the NDIS works. User cost of capital, in short, how we use the funding through the NDIS to deliver homes and housing for people. And where the cost of that accommodation exceeds a reasonable contribution from that individual, how do we house, in Victoria, the 100,000 people who are looking at the NDIS as a way to secure affordable long-term housing? Housing was a central promise in the NDIS deal. Halfway through the trial, we see no sign of any investment in housing by the federal government or the NDIA. And finally, in light of what is how community services operate in Australia, the most extreme case of vertical fiscal imbalance, we want to make sure that the Commonwealth starts releasing the money collected through the increased Medicare levy, which has been a little while now, and start to release that money into the system now. I want to stress that Victoria is very committed to the NDIS because we've seen what a game changer it is. And the evidence of my own eyes and experience over the last 4 months tells me that that's what it is. It's important and crucial that the Commonwealth and all the states come to the party in the negotiations that are currently underway, which we've got another meeting on Friday with our friends from the Commonwealth. If we don't get a reasonable arrangement, as we're required to under the heads of agreement from COAG by the 30th of June this year, then we risk getting it very wrong in the long term. And that would be a great shame because there are very positive results that we've seen in the Barwon trial area. I just want to talk about some of those choices and how the market system has operated down there as an example about the entrenched disadvantage. If we're talking about the NDIS as a model for how other social reform services might play out in time, then there is a lesson there about choice, and it is a double-edged sword. One of the great strengths of the NDIS is its ability to offer choice, but it comes as a risk. I was in Geelong recently talking to a range of participants and their families about how the system was operating at the halfway mark. And I saw two very contrasting examples of what choice can mean in people's lives. The first example was an accountant I met who had been made a paraplegic in an accident. He had used the NDIS and the funding for his support package exceptionally well. He'd tailored it to the package of support he needed, and this had dramatically improved his standard of living. He was able to do this because of his accounting skills, his ability to negotiate his way through systems and structures that were quite complex, and he surrounded himself with a group of friends and advisors who informed him on the range of options about using his funding well. Having sat previously outside the state disability system, the NDIS was working very well for him. At the same meeting, there was a truck driver from Corio, and he had a family of 6 kids. One kid had autism, severe autism, and another had a severe physical disability. He wasn't so interested in choice. He just wanted a system that provided the services his family needed and that he had, up to that point of time, perhaps not as well as he expected, but he had been receiving from the individual support package delivered by the state. He wasn't so interested in exploring a whole series of complex choices and possibilities, particularly as his wife was now suffering severe depression. Here we had a man whose response to this system was to threaten physical violence on the minister. It didn't quite come to that, but that was a legitimate response to the circumstances of the difficulty he was facing. The lesson from these two meetings is that we have to be careful about assuming that more choice is always better. For some people, it works well, and for others, it doesn't. Markets are not neutral instruments. Some people with a disability, particularly some with a cognitive disability or complex mental health issues, will need to exercise choice and to understand how the scheme can work in their interests. And that's a lesson that should apply well beyond disability community reform. Most of us struggle, and I know I do, when it comes to the choices associated with anything from mobile phone plans to superannuation. So it's a bit unreasonable to expect some of our most disadvantaged people in our community wading through, in difficult life circumstances, complex choice-making processes with little support. The NDIS will need to provide simple, easy-to-understand information and support for people with a disability and their families to exercise effective choice. I think the second lesson from the NDIS is the way that is effectively identified the wider economic benefits that can come from reducing disadvantage. There is a strong argument, as Steve has said, beyond economics, about the value of a fair and compassionate society. It's about a mutual argument and a mutual agreement that we as a community need to come to. It is certainly the case that the economic argument behind the NDIS and the support that is received from both sides of politics and from the Productivity Commission has been probably the most powerful argument as to how it has got as far as it has. But we cannot let it fail before it starts, and we cannot let its opportunities as a model for reforming how wider community services are delivered to also fail. There is a strong economic argument to tackling disadvantage. If anything, it lacks an agreed and accepted measure or a scale of how we deal with the impact of investment to address disadvantage. Yes, there might be a saving in the future, but how do we book that saving and that investment as an opportunity to government activity now? The third lesson is that whilst there's a model of insurance based on the particular needs of the NDIS, we could in fact look at replicating some of its core learnings to other areas. For example, organising support services around the needs of users of services, not the providers of those services. Providing more early support, which can often prevent serious problems occurring later, and providing the type of support that helps people reintegrate themselves into their community. The prerequisite for much change to be possible is the integration of those services and the joining up of what government currently does across departments and agencies in partnership with communities and the private sector. Perhaps more fundamentally, it means questioning the role that government has, not should government have a role, but the type of role it brings to resourcing and coordinating to maximise the collective impact of community, private sector and government. The fourth lesson is that any substantive attempt to reduce entrenched disadvantage will require timely and adequate funding from our friends at the Commonwealth. This is particularly clear when you look at how we tackle the problem of homelessness. Last year, approximately 100,000 Victorians used homelessness services. That's the capacity of the MCG. Since 2009, the states have had a national partnership agreement on homelessness with the Commonwealth to help share the costs of homelessness services reasonably. And there was an expectation that we were moving towards a national goal of halving homelessness and rough sleeping by 2020. Halfway through that period, it's sad to report that we are going backwards. In December, the Commonwealth announced that it would be cutting $21 million from the funding of homelessness bodies. On top of that, we've seen a situation now where the Commonwealth have unilaterally declared that there will be a new national partnership on homelessness targeted, rightly, towards youth and families dealing with domestic violence, but paid for by savings elsewhere in the portfolio. This will effectively come at the expense of rough sleepers, other groups dealing with homelessness, particularly the elderly and Indigenous peoples, and it will also come at the expense of some of the most innovative programs, such as private rental sector brokerages and partnerships that have been sought to deal with homelessness. That particular cut, disappointing as it was, goes well beyond just the levels of the cuts. It reflects a kind of sinister Orwellianism sneaking into how governments deal with disadvantage. A cut is dressed up as an improvement. It's newspeak at its worst. Victoria's view is that agencies that provide homelessness services need certainty, and certainty for the long term. So whilst it's troubling to see the Commonwealth only wanting to offer a more restricted 2-year funding, it's important to note that the terms of that have not yet been settled. That's not the way to create the stability for the service providers or the communities to act in a predictable way for the delivery of the kind of services your report talks about. It's certainly not establishing a market, it's more a political free-for-all. My final lesson in just drawing on the NDIS and other experiences in my portfolios shows us the potential that exists in using the private and government funding and the community sector funding can actually produce. This in turn points to how the opportunities for disadvantage can be dealt with. The scale and the nature of disadvantage that some people in our community experience won't be solved by traditional models of how we deliver services. We need to consider hybrid models that involve community, government and the private sector. Not a lesser role for government investment, but a different one that looks to maximise the collective impact of all the funders, levers off local knowledge and tries to connect culture and place in change. And through that, such as models that we can see as the NDIS rolling out, we will create change. But it will also create a lot of opportunities for the users of those services and for the new and existing providers of services. So why don't we resolve here today, on the basis of this report, to turn some of its learnings into practical solutions. Let's start and pick a few areas to kick off. For instance, just one to have a think about, and there are many, is let's look at how our corrections system operates here in Victoria, where the tough but dumb policies of previous regimes have seen us with the truly bizarre coming together of increasing rates of crime, huge growth in prison numbers, which grew 15% last year, massive costs to governments, increased reoffending rates and blowouts in costs. And when you overlay that against the notions of entrenched disadvantage reflected in this report, it's informative to realise that 2% of Victoria's postcodes deliver 1/4 of our prison population, and that those same prison populations are disproportionately represented in acquired brain injury, poor levels of education attainment, mental health and drug and alcohol abuse. So it's not as if we've got a shortage of areas in which we can trial the sort of work that this report sends us here today. There are many, but what we need is the political consensus, the community consensus and the opportunities to be serious about it. Let's tackle those places that reflect the 2%, and let's get serious in our partnership between government, community and business. It will take more than our combined efforts to achieve this. It will take a new national resolve to keep Australia the land of the fair go for all in the 21st century, and I think the CEDA report today is an excellent opportunity and an excellent start to have not just a debate, because we've had plenty of those over the course of the Australian Federation, but to get serious about the opportunities for long-reaching social and economic reform in this society to try to deal with what entrenched disadvantage means in the 21st century. So thank you, Steve, and thank you for the opportunity to say a few brief words.